If you are undergoing testosterone replacement therapy, TRT, and are also taking Adderall, it's important to understand the potential interactions and effects. This video will cover the side effects, physical and psychological benefits, and the possible risks of these drugs. Adderall is a common stimulant used to treat attention deficit hyperactivity disorder, ADHD. It helps to improve alertness, focus, and concentration, but there are a few things you should know before you begin taking this medication. Adderall is a blend of amphetamine and dextroamphetamine. According to the 2022 National Survey on Drug Use and Health, 1.5% of people aged 12 or older, or 4.3 million, misused prescription stimulants during the past year. Adderall is a combination of amphetamine and dextroamphetamine used to treat attention deficit hyperactivity disorder, ADHD, as well as narcolepsy. Adderall contains amphetamines and dextroamphetamines, two central nervous system stimulants. They improve focus and reduce impulses by increasing the levels of dopamine and norepinephrine in the brain. Some men experience unwanted side effects of Adderall, which can affect their sexual performance and desire. People with depression or bipolar disorder should not take stimulants such as Adderall because it increases their risk for manic episodes triggered by these drugs. Stimulants such as Adderall can increase blood pressure, body temperature, and heart rate, keeping you awake and active while suppressing appetite. Unfortunately, however, stimulants like Adderall can have serious ramifications on heart muscles, lungs, and vascular systems, and lead to irregular heartbeat or sudden death for those suffering from existing cardiovascular issues. Male hypogonadism does not appear to be a risk with stimulant medications for ADHD. However, recent studies have examined this link. Although the pathophysiologic link is unclear, it is predicted long-term ADHD stimulant medication use could increase the risk for hypogonadism among postpubertal men. An analysis of data found that there is a higher risk of hypogonadism for patients on long-term stimulant-based ADHD therapy than those men who didn't receive stimulant therapies. While there is limited research on the specific interactions between Adderall and testosterone replacement therapy, TRT, it is important to be aware of potential effects and considerations. Adderall can increase heart rate and blood pressure, and TRT can also have cardiovascular effects. Therefore, combining the two medications may increase the risk of cardiovascular complications. Additionally, both Adderall and TRT can affect mood and behavior, so it is important to monitor for any changes in mental health while taking both medications. It is recommended to consult with a healthcare professional before combining Adderall and TRT to ensure safety and effectiveness. However, research published by the British Journal of Pharmacology in 1996 did analyze the effects of amphetamine on testosterone secretion. This study used rats and found that amphetamine had a negative effect on testosterone production. More recent research published in 2017 found that a stimulant called methylphenidate, which is the compound found in similar stimulant drugs to treat a similar condition, found that low usage didn't cause much of an effect on testosterone levels. A medical case report published in 2022 details the effects of TRT and Adderall on 3 men. Drugs such as Adderall that are prescribed to treat ADHD can cause side effects that prevent their use in some patients. In one such case, a patient lost his libido whilst under treatment for ADHD. As a result, he was offered TRT to help reverse his loss of libido. The TRT helped with his low libido and low testosterone level, but also helped alleviate some of his ADHD symptoms. It was concluded that lower levels of testosterone may be a contributor of ADHD symptoms, and TRT could provide benefit for these patients. Both forms of treatment come with their own set of risks. Both treatments are not to be taken lightly and must only be prescribed by a doctor, and whether the two treatments should be combined would be down to the patient's individual circumstances and judgment of the medical professional. However, it appears there isn't much evidence available regarding combining the two therapies, but what evidence is available does suggest that Adderall reduces natural testosterone secretion, but when you add TRT, it can alleviate some of the ADHD symptoms.